Albuquerque City Councilor Nicole Rogers, thanks so much for being here.
Thank you for having me.
Now, I want to start broadly here. When considering the International District as a pharmacy desert, which residents are most impacted?
I'm so glad you started with that question, because for me, that's who I'm really most worried about, is our most vulnerable. So our seniors, and I think specifically transit dependent residents of District 6, which from the data that I've been pulling, we have over 8,000 households in District 6 that do not have a vehicle. And there are even segments of families that have vehicles, but kids have to ride the bus, or one parent has to ride the bus. So there are a lot of transit dependent folks in District 6 that now have to go further. And if they need to get their medication on a Sunday evening, even if the pharmacy's open, transit does not run Sunday after 7 p.m. So I think for me, it's the most vulnerable that I'm worried about, especially our seniors.
Okay, so what options are available right now for people who live in that area who don't have access or the ability to drive?
Well, I think right now, because Walgreens is gone, CVS is gone, Walmart's gone, the closest place I would say is Smith's. But no, Smith's on Lomas doesn't even have a pharmacy they don't. John's Pharmacy, I think, is the closest that I can think of, where in my neighborhood on Wyoming, like just after Wyoming and Central area. Outside of that.
So how do they get there? How do they get their medication?
Yeah, I think that's why I'm worried. People either are having to switch to delivery. And then if you're doing delivery services, now they're charging for delivery for some, because they're using places like DoorDash. I have a chronic illness, so I get medication every 3 months. And so even trying to myself navigate that system to get stuff, because I've been trying. So, okay, let's see. Let me go into the Walgreens app like they tell you to do and see if you can switch to delivery and how quick that is. I still haven't been able to figure that out. Even myself as a, intelligent person that is really good at technology. So I think right now that is the option, especially for our senior homebound folks and transit dependent folks, as they're trying to navigate how to switch to a company that will deliver your medication directly to you. Same with food delivery services. But again, that's an extra cost and burden for folks who already are, in poverty.
Now, you've proposed signing up residents for a program called Express Scripts, similar to DoorDash, which you brought up, but for pharmacies and medication. How exactly would a large-scale rollout of a program like that work? And would it be more difficult for anybody in particular?
It is difficult, because I think what I learned from my time in healthcare is that's dependent on if your specific provider for your healthcare allows you to use Express Scripts. So not every carrier of every healthcare offerer in our state can use Express Scripts. So I think that's the biggest barrier, is we would need, as I'm researching, we would need some really statewide legislation or something to mandate that our MCOs allow folks to use delivery services like Express Scripts. I think, or how do we mandate that they can't charge the delivery for that? But then the pushback is going to be, well, how do you expect us to be able to do that and not and eat that cost, right? So there's a balance to that as well. So this one's a tough conversation. But what I do know from research is where local spending is higher for local governments, life expectancy is higher. And that's what we're talking about here. We're talking about people's life expectancy. So when we talk about food deserts, we have to talk about pharmacy deserts and the supply chain for both of those items, right? For how do we even get our medicines to Albuquerque? How does that work? What is our food supply chain? What is our medical supply chain? Those are bigger questions that, bottom line is this is people's life expectancy. And it's not okay that people who choose to live in District 6 have to have a lower life expectancy because we don't have fresh food and pharmacies to get the medicine that we need.
How did we get to this point? Why have pharmacy services in your district dwindled to this level, and what roadblocks are there to bringing them back?
Yeah, I think there's a lot of factors. We obviously hear about theft in places like Walgreens, CVS, Walmart. You've heard of that circling in the district. I fundamentally feel like we've always had certain types of theft in retail. I've worked in retail. There were loss prevention specialists and things, insurance to cover loss prevention types of initiatives. I think the difference here, though, is the organized rings that were going in, putting people's safety at risk in the stores. And I think companies had to make hard decisions about that. So that's a bigger conversation about public safety, infrastructure in my district around, do we have nice park? I mean, people don't think that that matters, but it does matter to have infrastructure for parks and roads and lighting and places people want to live, where businesses want to come and stay. And I think that's a public safety issue. That's a healthcare system issue, access issue that we have. There's so many factors to this. And we have, when you think of unsheltered folks, not just even transit dependent folks, the medical needs are huge for our community.
Now, the Health Equity Council has put together a map of proposed pharmacy sites. What are your thoughts on developing those sites into new pharmacies? And I know you've touched on it a bit, but what needs to be done first to allow that to happen?
Yeah, I think for District 6 specifically, I think we have to have some tough conversations about why our district has historically not been invested in. I think that's an issue. I think we have to begin to flood the areas that need it most with access to healthcare. We need more clinics that offer pharmacy services in the clinic, right? That is something that we can work with our health partners on right now. And with people like owners of John's Pharmacy to say, you know, our mom and pop ones that have been in this community, how do we help them expand? And if they're willing to do that, right? How do we help them with the access to capital to be able to expand? I think that's, I would like to see us figure that out. Mm-hmm.
Okay, now we know Walmart closed in March 2023, Walgreens closed in November 2023. Those buildings are still empty in a central part of your district. Mm-hmm. Are there any plans in the works to develop those sites to address this pharmacy desert, but also what you mentioned too, grocery access in the International District?
Absolutely, that's top of my priorities, and I think because it's top of communities' priorities. And so we absolutely are continuing to try to acquire Walgreens, CVS, Walmart, and I will keep saying Walmart is, you know, really holding out for the highest bidders, I think. And so sadly, you know, for me, my job is, I think for these particular sites, is to look at what's available to us to, if they're not willing to sell to the city. Talking with developers who may have access to the capital that I don't in District 6 right now, to be able to say, hey, how can you help? In talks with Walmart, in talks with these other companies. So that's kind of my strategy, is let's talk to all of the developers who are interested in these properties and talk also at the same time as we're trying to figure out how to acquire them. So I think we need to work together. I think it needs to be all hands on deck. We need to figure out how to stack capital to make these projects happen in District 6. I'd like to see a group of us went to go see the Silver Street Market model with affordable housing, farms. The only thing we would add to that is a clinic with a pharmacy, to see how we can recreate that in District 6. City owns this Catherine and San Mateo lot. What if we can recreate that there with a clinic? Community wants access to healthcare, food, housing, and daycare. That's the top 4 things that I'm hearing during our strategy sessions and everything as we're out in the community. And so why can't we do that in a development and then keep that model going throughout? And then home ownership and poverty. We have to be working on poverty. This is the root underlying cause of all of this. Because if a resident in District 6 is not in poverty, they can go somewhere they have a car to go somewhere to get their medication. They can afford the delivery to come here. So all of these things tie to poverty, and that's the root cause of all of this, and that's what we should really be tackling.
What can we do to make people aware that all of these issues are connected, and what's the first step to addressing those underlying causes?
Yeah, I think we have to have some education for community and not make poverty such an other thing, like that's happening to someone else. Because as we're in the community teaching people about situational poverty, and have you ever had to postpone a bill? That's situational poverty, right? And everybody can relate to that. There's generational poverty, right? And that's what we see a lot of in District 6. The generational poverty that keeps people in this cycle that you can't go to your mom and say, hey, mom, how do I get a leg up? Because mom was in poverty, grandma was in poverty, great-grandma was in poverty. So I think we have to do the education so people don't see it as such a other thing, and that you too have dealt with everybody has dealt with situational poverty at one time or another. Everybody's heard the rob Peter to pay Paul saying, right? It doesn't matter where you come from. We've all had some type of situational poverty at some point in our life. And understanding that not everybody gets the same financial principles. That's why I talked about it in the campaign, and we are doing it and delivering on it in Office of Financial Empowerment. That's already off the ground. We got the strategic planning grant and we're also getting the implementation grant from cities for financial empowerment. And this is exciting because for once we can focus on economic development is important. Economic development is about business development. But financial empowerment is really about giving people in poverty the tools to get themselves out. And that's only going to help our community.
All right. City Councilor Nicole Rogers, thank you so much for being here.
Thank you for having me.
Yeah.